by the Women in Health Task Force. This webinar will be given to us by Professor Amani Rifat. She is a professor of the School of Health Science from Walden University, and she'll be speaking to us about a subject that she has a vast amount of experience in, and that is female genital mutilation, a severe form of violence against women. So, Amani, we are excited to hear the presentation.
Thank you, Mary. Thank you, Mary. Yes, I have a lot of work on that subject because it's really a severe form of violence against women. Can you please next slide? Yeah. This is my outline. I'm going to talk about the definition and classification, the prevalence, and the medicalization and the consequences, and the current international effort to combat it. Next, please. Well, this is the definition by the WHO. It's called FGM, or female genital mutilation. It's any procedure that partial or total removal of external female genitalia. And the most important thing is that for non-medical reasons. And it is not indicated for any medical reason. Okay, it doesn't have any health benefit, and it harms girls and women all over the world. Next, please. Well, in most of the world, in the area it is done in Africa and Middle East, it is done for children, for young girls, less than 15, before puberty. So it is again a violation of the right of the child. Usually a girl is playing and having fun, and then she's taken to have this harmful practice to her and make a lot of change in her future according to that. So it is a violation of her rights as the girl and child. She doesn't have any right to say no. Of course, because it is healthy and normal tissue, it is removed, and it interferes with the natural function of girl and women body. Next, please. This is a graph from the WHO according to the different countries, and you notice that most of the countries do it under the age of 15. However, there are many countries also do it more than 15 years. Okay, overall. I personally saw a woman coming in intensive care when I was just a newly graduated physician. She came by hemorrhage. She was married. She was over 30. And the hemorrhage was because her husband asked her to perform the circumcision. We call it circumcision. And I will talk about that. The cutting, because he's not satisfied by the degree of cutting in her. So she went through that through a midwife, and of course she came to the emergency room by severe hemorrhage. And it was only, and she has children, so she could die from that situation. So in some situation it is older age, and of course with a lot of them. In some countries they do it for babies. And I know that in that case, in Western country, Africa, they do it to babies less than 4 years. And this is make less recall of the painful consequences. However, it doesn't prevent the other harmful effects. Next, please. Okay, this is another term, which is cutting. Well, this is because some of the NGOs and activists against banning or activists for, they asked for changing the title of mutilation, because parents are doing it in good faith. They are doing it for their daughters because of if you say that you are mutilating your daughters, they will have a defensive mechanism and defensive attitude, and they will not collaborate. So they said, well, let us make it a natural or neural term, it is cutting instead of mutilation. So you will find it in literature that using FGC is similar to FGM. Okay, next please. Okay, this is the old term, the female circumcision. In many countries, they say it's circumcision because they think it is similar to the male circumcision. And now we know it is not only religious practice in men, it is for health benefits for men. However, it is contrary to the in female, because in women, what they cut is the healthy. It is like cutting the penis, not that just only the prepuce that is done in circumcision. So they say, well, we do circumcision, and they put the religious umbrella all over it. So it is another term used to describe the process. Next, please. Well, there are classification, a lot of classification. I will be focusing that. Type 1, which is just removal of the clitoris and the prepuce, and all. Okay, so it is just a removal of that. Of course, the clitoris is the sensitive part of the female genitalia. So when they cut it, they limit the sexual pleasure or for the women, and under the claim that they keep her clean and polite and chastity and keep virginity, no extramarital relationships. However, it's a kind of control. So this is the first type. Okay, next please. Next, type 2, which is the clitoris and the labia minora. Okay, so it is called excision. They remove the clitoris and the labia minora. Sometimes they remove the labia minora only. They remove partial of the clitoris and part of the labia minora. It is done because it is not medical procedure, so there is no surgical procedure for it. Not like any surgery. When we were learning surgery, we know that there are steps for each procedure. But for this, they just do what they see at that girl. So a girl could differ from the other because they can do, especially if the traditional midwife or barber or even physician, because it is done for babies or young girls. So whatever they can do, they do it. Next, please. This is the severest type, which is called the encabulation. They not only cut, they oppose and sue the labia majora. So they close the vaginal opening and they leave just a small opening for the urine and menstruation. And they not only remove the labia minora, but they close and they oppose and close the whole area. Okay. Next, please. Okay. It is mostly in northeastern part in Africa, like Djibouti, Eritrea, Ethiopia, Somalia, and Sudan. While West, they do it to clitorectomy and excision. Also here in Egypt, they do it the first and second time. Not all areas do the third type, and it is the most severe and with the most harmful effect, of course. Next, please. That's the reverse of infabulation, de-infabulation. What happens that they close now the vaginal opening, so they open it again to improve her sexual or to facilitate her childbirth. Okay, so it is a reverse operation again. So you are exposing the woman to another operation, okay, for no reason, as a matter of fact. Okay. This is a different type. It is practiced in some, I remember, God bless her soul, Rugaya, we were talking about that, and that's what happened in a country like Indonesia. They do pricking or piercing, the scraping. It is not removal at all. It is symbolic. They mentioned that it is symbolic there for that. So it is not common practice, but it is also considered in some. And I remember in one lecture, in one conference, there was a professor of gynecology, and there was about that. He talked about that, and he said he's against the practice. However, sometimes a parent brings his daughter, and he insists that he will do with him the practice, or he will take her to a traditional daya or traditional birth attendant. So what we were doing is to satisfy the parents and to avoid them and to prevent them to do harm by going, and more so he do just scratching and convince them that he did that. So it is a kind of sometimes dealing. However, you never know if the parent will discover that after that and will do it properly from their point of view or not. Okay, next please. Of course, as I said, that the extent of flesh taking and the extent of the risk and severity depends on the type and the procedure itself, the process that they do with the practice, and who is doing it, and the instruments used. So it differs from a girl to other. Okay, so and they remove whatever they remove, and they do harm as much as they can, and you never know what is the effect for that girl in the future. If it passed while she's child, there is long-term consequences they do not see it at that time. Next, please. Okay, that again, as I said, this for who like to read more information, that the majority is type 1 and type 2, and the 10% are type 3, which is mostly in West Africa, is the infabulation. Okay, next please. Well, it is high, because it is done in many African and Middle Eastern, okay, and immigrants from these countries. So in America or Europe or the West now see cases, and sometimes I heard in conferences that parents, immigrants from take their daughters to the home country to do the practice and return back to US or to Europe. And the physician who is accustomed in examining them gynecologically would face a problem during examination or childbirth, and they have to know how to deal with that cases, because it is not only at the at these countries, and it is expected that so far the practice is that more than 3 million girls are at risk of undergoing it every year. Every year. Next, please. Oh, this is the country, as you see. It is mostly in Central Africa. They call it the belt of the practice. And as you see, the highest, unfortunately, in some countries, over 90%, like Egypt, Sudan, Somalia, and Mali. So it is highest there, still very high, over 80 or over 90% there. And as you notice that in Northern Africa there is no, Southern Africa no, even in the Arabic countries, only Egypt and Sudan and Yemen, and some in Iraq, very few. So it is not even in other countries. So who claim that it is related to religion or nations? It is not, because you don't find it in Saudi Arabia or Iran or other Islamic country even. So it is mostly in that area. Okay. Next, please. Well, the trend is encouraging. Okay, there is noticeable decrease in prevalence. There is now younger generations are led to practice it to their daughters. However, there is the influence of grandmothers is still there. The older generation, not the mothers, because in many field work we had, the mother could oppose it, and because she called the painful experience, and she's against it. However, the grandmother usually had the upper word, and she insists, and usually the husband mother who insists to do that for her grandchildren, daughters. So it's still having the influence, but more and more it is decreasing. As you notice, there is a difference between mothers and daughters for having it. Next, please. Well, another determinant is the education. The more the woman is educated, the less that she will accept that practice. Okay, it is done among the less educated women, okay, or that with no education in different countries, and this is our trend seen in different countries. So education is a strong influence of abandoning this harmful practice. Next, please. Again, poverty. It is associated with a lack of education, of course. But however, poverty is increasing the prevalence, while richer and riches are less to do with. Again, wealth by itself it may not be indicated, because in the middle income population, they are still practicing. But they reclaim that the wealth is associated with education, because wealth by itself sometimes is less, because here they are less, but not like the influence of education. Next, please. Well, as I said, this is another explanation that fewer daughters are cut compared to mothers. Again, next, please. Here is another figure to compare mothers and daughters. The same encouraging trend that it is decreasing all over the countries. Next, please. That's another. As you see, the daughters with at least one daughter are less than the mothers. These are different maps and figures from different resources to confirm the same trend. Next, please. Well, the higher prevalence, again, mother may truly oppose it, but the complex set of beliefs and social constraints, they cannot resist the older generation. Not only the older generation, in fact, the community pressure. Because when I talked with mothers before in my country, in community, I found them, they say no, but her neighbors say, what are you going to leave your daughter like that? She will not be married. So she is under community pressure. If she even doesn't like to do it. And sometimes, that's a funny story that one of the women told me, that her daughter was playing with the neighbor's daughter in their home, and the neighbor brought the midwife, the traditional birth attendant, the daya, to perform it to her daughter and to the neighbor also. So she didn't have a say. She didn't know except after. And the neighbor considered it as a compliment to her, that she helped her to, and she wasn't annoyed, as a matter of fact. She thanked her that she did it for her daughter. It's like a gift for her, or a compliment to do it. I wonder if the neighbor cut the girl hair, would she consider it as a compliment? I don't think so. She will quarrel about that if she cut the hair. But if she cuts the genitalia, that's okay. So it needs a lot of awareness among the community. Okay, next. Well, why do you do it? For different reasons. It's a rite of passage. It's a control of the girl's sexuality. Of course, it will reduce the sexual desire. However, this is a sort of inferior look for the girls and the women, as if they don't have control on their own sexuality. They don't have brains. So you are cutting them to prevent them from making any unwanted sexual activity. Next, please, others. Well, it is more feminine in some. Also, I have a student who did a PhD in Kenya. One of the reasons in the tribes they have to do it is to take a higher dowry for the girl, because if she's not cut, she will take less dowry. Okay, so it is economic also, not even. So they think better marriage prospects, cleanness, enhanced sexual pleasure for the men. This is the point of view, ma'am. Okay, not good. And the last one, they say religious approval. They don't think really it is for religious reasons. Next, please. Again, religion. This practice is predated Islam and Christianity. So it is also done among Jews in Ethiopia, the Falasha, and it is done in communities without any religion, or they are not classified as Muslims or Christians. So it is, so the claim that it is under Islamic or religious requirements is not supported because many Islamic countries do not do it, and it is done in other religion, and it is mostly African in tradition. Next. Next, please. Yeah. Okay, as you see that men, oh no, the previous one, please. Okay. Men approve it more. Men approve the practice. They think that it is for better in many countries. Okay, they are more to support the continuation. So it is awareness should reach men also, not for women. So the practice should be discussed with fathers, not only mothers. Okay. Next, please. Well, in many countries, it is traditional practitioner. The disaster of having medicalization, of having a doctor or nurse or a midwife trained is increasing all over the world. Next. Next, please, Mary. Oh, yeah. This is the medicalization. This is a new trend. It is in many countries like Egypt. It is a new financial gain for doctors. Under the claim they will avoid the harmful effects because it is done under septic procedures, under with anesthesia or whatever, and so they do it in private clinics or our homes. So they are now taking the lead of having that. It is in many countries, and I attended a meeting in 2009 in Kenya for discussing strategies in countries again to combat the medicalization, because this is a new trend happening in many countries with a lot of physicians. Like my country, we have a lot of physicians. So now the trend is to do it with the doctor instead of the traditional birth assessment. Next, please. They are. I conducted a study among physicians in Egypt, asking them, and because it is banned, it has to be confidential study. They are convinced by it. Many of them are convinced that it is required by religion, and that it is they are doing good because they are far, especially those from rural origin, and so they are agree to do it. They say, well, we are see the practice as not harmful, so why not do it? We will control it like any minor operation. It is the confidence of doctors. Okay. Next, please. Well, the who do not do it themselves, they support it. They consider that to support the patient request. So far, the patient asked for that, or the parents asked, so why not comply for that? Of course, it is a source of financial gain. Well, some claim that it's a harm reduction. We are doing it to prevent the more dangerous effect of traditional birth attendance. And we do it. I heard one, I entered in discussion with a gynecologist who told me, no, I'm protecting the virginity of the girl. I am beautifying her. I'm not cutting or I'm not mutilating her. So they are defending, very defensive, who are practicing. Called financial gain. It is a lot of money there. It is a process done. Next, please. As you see, it is increasing. This is the prevalence in Egypt, in my country. Okay. Unfortunately, the recent one that just came in of 14. It is increased again. We passed through some years of political unrest, and there was all influence of conservative government who were opposing the abandonment that was done by previous government and political commitment of the previous ruler. So they increased it again. So it gets higher again. So hopefully now we are to control that. We are returning back, and the Egyptian Women Council is regaining its power now, and they are calling again for the children. But however, the 1 or 2 years that were under the governance of that conservative group, they claim that they are Islamists. However, it is not supported by religion, and I'm Muslim, and I see that it is not supported by religion. And every year I was giving that lecture to my medical students. In Egypt, I have 1 or 2 students standing to argue with me about that is a religious requirement. So it is still confusing to many people, and under that claim, they are controlling that practice. Next, please. Doctors do it in Egypt. This was 2008. 2014 didn't measure it. However, it measured prevalence. And you see that nurses also and Zendaya, or the traditional birth attendants, do it. And that you see some of the mothers say, we don't know who did it. Okay. She doesn't know who did it for her daughter. Okay. Next, please. This is the increase of medicalization in Egypt. This is the trend. It is increasing. It is banned. And every now and then a doctor is disbarred and imprisoned because of the practice. Why? Because it is illegal and it is harmful. You are destroying it. Why they are, when they are caught, when a girl is dead or having severe hemorrhage, and the parents complain, that they go and complain for that doctor. Otherwise, they can they don't pay. So they have to be reported. That those doctors should be reported. But the parents usually do not report it unless the girl is dead or having a lot of harm during the operation. No, previous, please. Okay. This is another issue that we don't teach it in our curriculum. And if you open any textbook of gynecology or surgery, you wouldn't find it. Because it is not medical. It is not required. However, doctors do it. So it is not legal, not only legal, it is not standardized. It is not like tonsillectomy. Every physician knows how to do it. Or appendectomy. No, it is not taught. They don't learn it at medical school, either in undergraduate or even postgraduate. Next. Yes. This is my study. They know about the consequences. And there is some who deny it. They say no, there is no. And some they said that they don't know. The less they said don't know. But the majority know about the consequences. They know. Okay. Next, please. Most of them approve it. Only 18% approve it. However, they approve it for religious observation. They say they approve it because it is religious. And they said that it should be continued and the doctor should do it. However, the other half say no. Nobody should do it. Okay. Next. Yet they do it. About 20% of them, 19% they do it. That's the one. And because most of them, because they are convinced and harm reduction, however, for profit is 30%, is more than harm reduction. Okay. So if you still have financial gain. Next. Yes, they have post-operative complications. They confess about that. But when you discuss it, yes, every operation has post-operative complications. You can expect from any operation, and we can handle it, unless it is severe and the girl has. So this is how they deny that the practice has consequences. Next, please. Doctors, because they do not know about a lot about the practice, however they do it, they are more to do it, okay? And they are more to be culturally influenced. They are more to be significant among more, and they are more to be from a rural origin physicians who are practicing. So they are doing it in villages, in their clinics, in some slum areas, among uneducated communities, but not in big hospital or expensive clinics. Next. Next, please. Well, here is the well-known. There are a lot of literature about the consequences. It is documented. A lot of consequences. Immediate at the time, severe pain. Of course, this is a very sensitive area. A lot of nerves there because it is the area where is there is feelings of the woman. So of course, type 3 is the most extensive. Okay, and because it takes more time, so it increased, and of course it has healing period. It has a lot of shock, and this happens a lot, either from pain or hemorrhage. Next, please. Excessive bleeding, hemorrhage, a difficulty in urine because of the swelling, infection, either contaminated urinary or female reproductive tract infection. And of course, death happens. Tetanus, shock. Next. Next, please. Well, the long term, even if the girl passed through that without hemorrhage, without shock, without it, there is the healing, the scars it caused for her pain. And there is infection, long-term infection. And I know in one of the seminars I was doing in the community, one of the women came to me and told me, I am a victim of that practice, that they did it to me. I'm infertile, and because they discovered later that she had blocked fallopian tubes because of a pending infection while she was young. Nobody noticed it, and she doesn't have the opportunity to be mother. So this is a long-term consequence, and it is documented also. And keloid because of the scar. Next, please. Sorry. Yeah. Of course. Sexually transmitted infection and HIV, especially when they do a ceremony in some of the African countries, and I know that in different African countries in Western, they do ceremonial celebrations for the girls. So they use the same instrument, the same blade or the same knife, and they do it for different girls. And of course, HIV also was transmitted through that. Next one. Next, yeah, HIV increased, especially in type 3. Okay, next. I know that the time is running, and I will try to summarize. Yeah. Birth complication, of course, gynecological, and it is also documented. Fistula, increasing the cesarean and postpartum hemorrhage because of difficulty of childbirth during that. And of course, prolonged and obstructed labor. The most denied one is the quality of sexual life. Sexual dysfunction or painful sexual experience from the scar or from the narrowing of the area, so it is also decreasing the sexual experience of the women. Next. Next, please. Yeah. Psychological. It is post-traumatic syndrome. Many of the girls do not forget that painful experience, especially if it is done at the age of 12, or they know about it. Okay, they found association with stress and anxiety, depression, and I heard a lecture from an Egyptian professor once. He associated it with depression, with obesity, because women are depressed. They do not have sexual satisfaction. So they are going to eat more and more. This is the only pleasure for them. Okay, so it is a kind of compensation. So it is a cause because they are depressed. So they are. We all know that the effect of anxiety and depression on eating and the figure. So it is not only disturbing the sexual, it is only the figure and the beauty of the woman. Next. Oh, yeah, that's what I'm with the repeated. As I said, they do it repeatedly. They open it in the infabulation, and then they can see it again. So they do reclosure for her, or requiring more to be removed. Okay. More pain and more consequences. They are unavoidable. Even if you say that we are doing by anesthesia, infection control, whatever. Because it is not legal and not standardized, if mostly they use surface anesthesia. This plain, they do not, and of course if they do general anesthesia, this is a really a disaster, because you are exposing the girl to a lot of anesthesia here for no need. Infection, the wound itself could be affected. Of course, there are cysts, keloid, and sexual dysfunction. Next, please. Well, it is irreversible removal of sensitive organ. However, there are now talking about reconstructive surgery. How much they succeed in even if it is reconstructive surgery, about sensation, they are still doing it. It is disfigurement and underestimation of the women control of their sexuality. As if they are animals. They cannot control themselves. And of course, a lot of complication. Next. Next, please. Oh, this is the advocacy and the international. There are lots of international and local in every country, NGOs, fighting and doing activities to there is a lot of organization, of course, WHO and UNICEF, because it is a children issue, are leading that against the elimination, and it is requiring all states doing that to report it and to abandon it. Next. Next, yeah. This is the newest guidelines from the WHO. I summarized it here, and you can go and read it. This is the coverage of that manual for health personnel. It's because we are against medicalization. Now we should, doctors should, as a positive social agent, should support and manage the complications that was done for these girls. They should be provided quality health care. They should, initiating, doctors should work with the community to eliminate it and to prevent that practice. Next. And the medicalization is a violation of medical ethics. Our ethics is to avoid harm. This is what we swear, and that's our oath. We remove pain, we remove harm from suffering. How come to go and do that to girls and women? So this is against the medical ethics. Okay, next. The infabulation. It should be recommended for obstetric complication. Okay, it should be, there is antepartum or intrapartum recommended to facilitate childbirth. It is recommended for preventing and treating urological complication. Next, please. Yes, mental health. These women suffered, so they have to have counseling and support and to treat them psychologically and to give them support for that depression or anxiety that they suffered. Okay. No, what they say, the silent endurance of women, that the women accept pain as a part of life. They have pain in childbirth, they have pain in that. That shouldn't be true. Okay, they need support, and life shouldn't be painful like that. Okay, next. We have to support them in sexual counseling. I know it is a taboo in many communities to talk about sexuality. However, health personnel should support women and refer them when they need help to treat sexual dysfunction. Next. Next, please. Okay, again, it is a violation of human rights. A lot of countries now criminalizing the practice. Next. This is many countries with their banned, and there are other countries so far doesn't have any laws that affect